Mr. Jack Carney, AHA certified instructor. Thank you for joining us today, Mr. Carney. Can you tell us a little bit more about what you do and what AHA stands for?
I'll take the second part first. The American Heart Association, they use that acronym AHA. And it's an organization that really has set the gold standard for cardiopulmonary resuscitation all around the world, not just in the United States. As for my part of it, I'm a retired firefighter. So in my semi-retired state, teaching CPR classes, primarily to healthcare providers, but also to any family members, new parents, babysitters even, medical office staff. And I think it's a good life-saving work, potentially. So.
Wow. So how long have you been a certified CPR instructor?
Well, I was certified within the last couple of years with the American Heart Association. Prior to that, I taught CPR as a member of the fire service to city departments and fire recruits. Actually, I've been either teaching CPR or taking a CPR class or first aid or EMT class since the 1970s.
Wow. Now, what changes have you seen since you first started out up until now?
Well, you mentioned a couple, the in with the good air and out with the bad. That was just a little bit before my fire service time. But in the early days, CPR was pretty basic. We didn't, at that time, have even an emergency medical technician program or EMT program in the United States. It was during my time in the fire service that EMT program started. And eventually, many of the people on the rescue squads were even paramedics or cardiac technicians. So that now, in DeKalb County, Fulton, Gwinnett County, many other areas, if you call for an ambulance, you'll probably get a fire engine first. And on that fire engine will be medically trained personnel, EMT personnel. So you really get pretty good medical care quickly that way. And they can communicate with the EMT services en route and also stabilize the victim or patient.
Now, recently in the news, it's been reported that hands-only CPR is just as effective as the hands-only and mouth-to-mouth. Is that something you agree with?
Yes and no. I'm a little discouraged that the media caught on with this hands-only as if it was the only sort of CPR anyone should do. In reality, hands-only is effective for a short period of time to keep oxygenated blood circulating in the system, but providing breaths, whether it's exhaled air or oxygenated air, is very important. So I don't think we'll ever see a time when trained EMT personnel or medical personnel won't be doing breathing as part of CPR.
Oh, okay, so you're saying that you should only do it just to get the oxygenated blood throughout the body.
Yes, and if you don't know how to do correct breathing, or if you're just afraid to because of pathogens, then maybe for self-protection, we'd be happy to have somebody at least do proper compressions. So I support that. American Heart Association supports hands-only CPR, as does a number of other locations like Mayo Clinic, for example. So hands-only CPR, if they're good compressions, can help to sustain or stabilize a victim, but only for a very short time.
So what about when the victim's been in a car accident and they're needing to be moved in order to have CPR performed on them? What's the corrective actions for that?
Well, we try to immobilize if possible, especially if we expect that there might be a cervical spine injury. If we see the head in an abnormal position, for example, we'd want to quickly stabilize that to the extent possible and then move the victim to a hard surface, a safe surface. As I've talked to you earlier when we spoke about this, I mentioned that that safe, hard surface might be in the middle of an intersection as long as traffic's been blocked away. You can't do effective compressions, chest compressions, with a victim sitting in a chair. You really need to have them on a hard surface.
Now, you talked about moving the victim. Does the risk of additional harm, such as additional bleeding or spinal injury, outweigh the benefits of CPR?
Now, I would say that the standard is still life over limb. If a person has suffered from a sudden cardiac arrest, they're essentially in the process of dying. So any additional harm that you may cause by moving the victim is negligible. It takes second place to actually get the CPR started, because the sooner you get CPR started, and hopefully an AED defibrillator in place, the better the chances victim of survival.
Now, when we spoke earlier, you said something very interesting. You said CPR is not about saving lives. It's about interrupting the death process. Can you expound on that a little further?
Yes, and I have to say this doesn't come from American Heart Association, but actually from the former director of a medical trauma center in Washington, D.C., MedStar. That cardiologist, Dr. Champion, taught us as we toured his facility that performing CPR isn't really saving lives, it's interrupting the dying process until advanced cardiac care can come to the scene. And that's important to understand. If someone has had a sudden cardiac arrest, CPR alone will not resuscitate them. It will only stabilize them until they can be defibrillated. There's a major difference between heart attack and sudden cardiac arrest. A heart attack is where some part of the heart muscle is not receiving oxygen. That's when we feel the chest pain, for example. But a sudden cardiac arrest is when a severe arrhythmia has stopped the heart beating completely. And that can't be reversed by CPR alone. So we really are just interrupting this process of dying long enough to get advanced care.
Okay, now, a lot of times when a person is, or a victim is having a heart attack and the EMT professionals arrive, they'll give the victim a nitroglycerin tablet, and that's supposed to stimulate circulation and stop the heart attack. Now, I've read that cayenne pepper does the exact same thing. Is that something you agree with?
Well, to be honest with you, I haven't seen in any EMT or cardiac tech dump bags any cayenne pepper. So I don't know how standardized that approach would be, but I've read the same thing. It can be effective. If that's what you have available, maybe you can give it a try.
Now, what if the person is unconscious? Should you still perform CPR on them?
Unconscious. Unconscious in the sense there's no breathing,
Exactly.
So no respiration, but they do have a pulse, a heartbeat.
Yes.
In that case, if someone's not breathing but they do have a reliable pulse, then what we would do is rescue breathing alone. And that's just giving them assisted air. So we give them exhaled air, or we use an ambu bag or some other device to give them air about every 5 to 6 seconds. That's so that whatever blood is circulating will be oxygenated.
So let's talk about a little bit more about what's actually happening when you're performing CPR. Now, I'm sure we all remember from science class, we breathe in oxygen and out carbon dioxide. So when you're giving mouth to mouth, are you actually breathing oxygen into the victim's lungs, or are you trying to stimulate breathing by breathing carbon dioxide into their lungs?
That's a great question. The fact is that back in 1907, a physician whose name escapes me right now determined by some studies that he did on his own that exhaled air has sufficient oxygen in it to sustain human life. And from that point on, breathing, exhaled air, mouth to mouth, or by any other means, has been part of CPR. Normal air may have 21% oxygen. Exhaled air may have 16, 17, 18%, but it still has some oxygen in it. So we're adding oxygen to the victim's lungs, but another important aspect of it is we're helping them to get rid of exhaled gases. Because in effect, if we don't get their exhaled air out of their lungs over an extended period of time, the blood becomes acidic. And if it becomes too acidic, it may be impossible to ever resuscitate them.
So what if the person has a tracheal stoma or a surgical opening in their throat? Do you breathe into the stoma and cover the mouth, or do you breathe into the mouth and cover the stoma?
That's a situation that's so rarely encountered. As I recall my EMT training, we breathe directly into the stoma because that's a known good air path.
So what about the AED devices? Is there an age limitation? Can you talk to us a little bit more about what that is and if there are any age restrictions on who you can use it on?
Sure. AEDs are becoming more and more affordable. People are becoming less fearful of using them, so we're seeing them more and more in public places like airports, shopping malls, gymnasiums, for example. If you go to the fitness center, you'll probably find an AED there. My dentist's office has an AED now, as I understand. As far as age limits, the American Heart Association doesn't make any recommendation for or against using an AED on an infant. For a child from about age 1 up to puberty, we recommend that you might want to try up to 5 cycles of CPR before using an AED on a child that small. For everyone else, quick implementation of CPR techniques or intervention with CPR and quick access to an AED are really important because chances of survival diminish rapidly over time.
I see that you've brought some friends with you today to show us how CPR is performed. Now, can you show us exactly how the victim is supposed to be positioned?
Well, ideally, in order to do proper CPR and get good chest compressions, the patient or victim should be on a hard surface. Most of the time, as a firefighter, we found them on the floor. If, however, someone had a cardiac arrest in bed, we would remove them from the bed, put them on the floor where we had room to work. On occasion, I've heard of someone having a full cardiac arrest in the hospital up on a gurney. In those situations, sometimes the person doing CPR might be up on the gurney with them to do compressions, but in my experience, most of the time it's been on the floor. In this case, we can do it on the table for purposes of demonstration since it's a pretty sturdy surface. To do compressions, I like to see the hands in the center of the heel of the hand in the center of the breastbone, just above the xiphoid process, shoulders directly over the hand. We keep the fingers up off the chest because we don't want to break ribs. Break ribs, you could lacerate lungs or do other internal damage. Compressions are hard and fast at the rate of 100 beats a minute. Now, all the American Heart Association students have heard many times we use the Bee Gees tune Staying Alive because that's 100 beats a minute. But there are many, many tunes you can use just to give you that rhythm. The important thing is to not hyperventilate. If you hyperventilate, then we're going to have 2 victims to deal with.
Right.
So we want to control that adrenaline rush by counting aloud, 1, 2, 3, 4, 5, 6. And we would do 30 compressions and then 2 breaths. The breaths might be given mouth to mouth. For students, we use a sanitary barrier. We would give 2 breaths and go straight back to compressions. The ratio is 30 compressions to 2 breaths. For healthcare professionals, a lot of times they'll have a bag mask or, in this case, a pocket mask. This is something you could carry in the glove compartment of your car. In a medical office, they might have one behind the counter at the receptionist desk or on a crash cart. A little bit different technique to get a seal, but you're still using exhaled air. So we do a head tilt chin lift, 2 full breaths. As we mentioned earlier, if this victim is just having a problem with breathing, but they do have a pulse, we give those breaths 1 every 5 to 6 seconds. Another device that we use, I'm going to reposition our victim here just a little bit, is an ambu bag or a bag mask. The bag mask comes with many different size face masks on it. You can see this one's about the same size as the pocket mask. But the difference between these devices is, in this case, we're not using exhaled air. So we're actually giving them oxygen from the air, normal percentage of oxygen from the air. We get a good face seal. And this is used in 2 rescuer CPR. Again, on the floor, I'd probably have my knee to brace the head tilt, chin lift, then just give the full breath. So if you had the ambu bag available, it's really a better device to use than anything else I've shown you so far because it's a higher percentage of oxygen. So we'd go straight to an ambu bag as soon as one was available. All the rescue squads carry ambu bags. That's probably where they got the name ambulance bags. Yes, ambu bags. We use that in 2 rescuer CPR. Single rescuer is going to go back to either pocket mask or some other barrier. The reason being it's very difficult to be at the head of the victim, do 2 breaths, run around to the side, do compressions, back to the head. So these are only used when you get 2 rescuers. Pretty simple technique, really.
And can you show us